No one leaves home unless home is the mouth of a shark. You only run for the border when you see the whole city running as well. You have to understand that no one puts their children in a boat unless the water is safer than the land. Year 2017. 3 humanitarian catastrophes overwhelmed the world. Disaster 1 is Syria. It began in 2011 during the Arab Spring by peaceful demonstrations for dignity. The regime responded in brutal force. War ensued. Half of the country is destroyed. More than 600,000 people were killed and millions were traumatized. The Syrian war unleashed a global refugee crisis and destabilized the world. Disaster 2 is Rohingya genocide. More than 1 million Rohingya refugees fled from Myanmar to safety in eastern Bangladesh. Almost all of them were placed in the largest refugee camp in the world. Disaster 3 is the war in Yemen. A cholera outbreak inflicted more than 1 million Yemeni civilians, and tens of thousands of children succumbed to severe malnutrition. MedGlobal was born to respond to overwhelming suffering. It was led by a group of humanitarians, doctors, and nurses who envisioned a world without healthcare disparity. They wanted to partner with communities and provide healthcare with dignity to the refugees, the displaced, the disenfranchised, and the victims of war and disasters. MedGlobal started to organize medical missions to Marib in Yemen, Cox's Bazar in Bangladesh, and northern Syria. They mobilized a wide network of global doctors and nurses and collected millions of dollars in donations for innovative and sustainable health programs. MedGlobal teams provide emergency response, sustainable healthcare programs, and build resilience in their healthcare systems so they can weather the storm. Year 2020, COVID-19 pandemic hit the world. Hundreds of millions of people were inflicted by the new virulent virus, and millions died due to severe pneumonia. Communities of color suffered more at home. In low-income countries, patients died in the parking lots of hospitals due to shortage of oxygen. MedGlobal rose to the challenge. We built oxygen generators in Syria, India, Sudan, and Yemen. They provided a lifeline that saved and continued to save tens of thousands of lives. The MedGlobal oxygen generator in Darfur, Sudan, was the largest in the country since its independence. It provided a lifeline to 5 million people. MedGlobal local teams provided PPEs, ventilators, oxygen cylinders, medical supplies, PCR machines, and mobile medical teams, and also provided much-needed training to doctors and nurses in 15 countries and at home. Year 2022. Another devastating war unleashed by Russia against Ukraine. MedGlobal was the first medical organization that responded. We sent 7 medical teams, trained more than 980 Ukrainian doctors and nurses, and donated $4.5 million of medical supplies. Today, for refugees, MedGlobal teams are addressing the health needs and medical health needs of Rohingya, Syrian, Palestinian, Venezuelan, Tigray refugees, and also the migrants at the Mexican-U.S. border. In war-torn Yemen, MedGlobal teams are running mobile clinics in Taz that improves access to healthcare to tens of thousands of patients in difficult-to-reach areas. We donate medical equipment to hospitals, nutritional support to children, and medications to patients with chronic diseases. In besieged Gaza, MedGlobal provides home health to the elderly Palestinians. We donated medical technology to Shifa, Nasser, Turkish, and Ratisi hospitals. We started a new wound care program and procured a large amount of medical supplies locally to improve the local economy. We also sent multiple medical and surgical teams to stand in solidarity with our Palestinian colleagues and learn from their resilience. In Syria, MedGlobal runs 4 primary health clinics that provides free health care to tens of thousands of internally displaced people and victims of war from Idlib in the west to Ras Alian in the east. We provide mental health programs, drug rehabilitation, vaccination campaigns, nutritional and winterization programs, training of community health workers, and much more. Within 5 years from its humble start, MedGlobal teams have implemented programs and left footprints in 24 countries. We have active and sustainable programs led by local teams in 8 countries in the MENA region, Southeast Asia, Europe, Central and Latin America, and the USA. In 1 year, we touched the lives of 9.8 million people and provided more than 800,000 direct health services. There is too much suffering in the world. Climate change, wars, inequities, famines, and old and new diseases are part of our lives. MedGlobal is making a difference. We are changing lives and extending a hand of healing to the refugees, the needy, and to the victims of wars and disasters. What began as an idea a few years ago has become a movement that heals millions of people.